Lisa is not able to be here tonight, but I do have the data that she did share out with our Board of County Commissioners on Tuesday. So every Tuesday at 1 p.m., we share out the latest data that we have. Obviously, it's a couple of days behind where we currently at. And so as far as what public health is doing, we continue to track and investigate cases. And currently we are up to, let me make sure I have my correct number before I give you misinformation. So give me 1 second. So currently we have a total of 50 cases. 28 of those cases are the PCR tests, which means that folks had active infection. We are currently monitoring 8 people, and 22 of our positive cases are antibody tests, which we were able to link to the other active cases, if you will, if that makes sense. And just more information that some folks had asked, the last handful of cases that we had, age-wise, are mostly in the mid-20s to the mid-40s. We did have a smattering of some children in there as well. The common thread has been, folks going out into the community in at like a social gathering, if you will, and then having kind of little family clusters, if that makes sense. We currently do not have any outbreaks at this point in time. Do not have any investigations around job sites or businesses as being identified as a place where people are becoming infected. So we still are looking at community spread. And that is where we're at this point in time for those pieces. Then, because of what was happening last week, the governor had issued multiple public health orders, the last one being amendment number 7, that now we've adjusted our own public health order to kind of come into line with that public health order. Basically, this was kind of cleaning up a lot of the pieces of some businesses that weren't identified in all of the other orders about whether or not they could open. The big piece being that, bars are able to open right now at a limited capacity. Our service clubs like Elks and Eagles are able to open. We continue to work with any other businesses. The museum's able to open. Everyone still needs to do a social distancing protocol, which you can do through our environmental health folks. And so far that's been very successful, and we continue to do that because any of the pieces that we are looking at continue to be that social distancing piece that includes face coverings as well as, hand washing, staying home if you're sick, as well as remaining 6 feet apart. The Lake County Public Health Order, the big piece that people have been talking about is the fact that we are requiring wearing face coverings while you're in public. If you are going to be interacting with anyone, we now have it as a requirement to wear a face covering in public. Obviously, if you have a health condition that doesn't allow you to wear a face covering, then we recognize that that is, allowable, if you will. Don't like to use that word allowable, but recognize that that might be an issue. But we also ask some of those populations that might be more vulnerable that if you don't have to be in the public, it's still, we're still in that safer at home phase, if you will. So it's still safer at home, if you will. And the next steps that we're looking at as a state is what they're calling Protect Our Neighbor. This governor is currently soliciting some feedback about what that might look like. And it will be dependent on all of the pieces that we've talked about before. For a county to move into that next phase, if you will, we need to have, decrease in cases over 14 days, the ability to do contact investigation on all our cases, the ability to test everyone that's symptomatic, the ability to continue to do our social distancing pieces. And so, as you can imagine, we continue to increase weekly with cases. So it might take us a little bit longer into that next phase. A lot is dependent, once again, on everyone's individual behavior as we interact with each other in society, and that personal responsibility piece. Because another question that we're receiving is around enforcement, and per what the governor continues to share as well as what we're sharing is the fact that it really is a personal responsibility for everyone to do their part, to wear a face covering in public, to stay home when they're sick, good hand washing, all of those pieces that we continue to talk about, being 6 feet apart. And I know that is difficult, especially as we're moving about and there's more celebrations happening. I think we have to be mindful as we start seeing these clusters popping up in our county for people that are interacting in larger groups. Granted, we have moved into the blue square face for those who remember that, which means that we can gather up in group sizes up to 50. While that's allowed, it's still not, the best prevention measure. At this point in time, we continue to push the prevention measures so that we can decrease the spread and kind of maintain and do responsibly reopening all of these pieces. And we can't necessarily move forward if we continue to see an increase in cases. So with that, I will show you the data. Give me 1 second while I share my screen. I apologize, I haven't done a PowerPoint before on this platform, so we'll see how this all works. Alrighty, so let me see if I can't do this a little bit better. Oops, sorry. Oh, my window stopped. Let me try this again. Thank you for your patience. Alrighty, so this might be the best. I was trying to do it in the slideshow, but let me see if I can't do that. And it will not let me do that. Oh no, maybe it will. All right. So this is the information that we have from the week of June 21st. We're going to look at what's happening at the state first. As you look at it, you can see that, we've been doing pretty well at flattening our cases, but now you can start to see, we're starting to see a rise. And remember, the data is a little bit behind because of the lag time between when people actually get exposed to when they actually start showing symptoms. We know that's anywhere from 5 to 14 days, if you will. So this is just reflective of what's been happening in the last 2 weeks, and as we continue to move around or gather in groups, that the anticipation is that this will increase. Well, maybe this wasn't the best. So as you continue to see, the numbers continue to go up at the state level. There were some questions around what the case rates look like around our surrounding counties. And so if you look at Lake County, and this is per 100,000, which I know can be confusing, but when we just look at that measure, we're at 618, Eagle is a little bit, is higher than us. So is Summit, but some of our other neighbors are much lower than us from Chaffee Park. And so when we measure ourselves up, it's kind of showing where we're at. And when you think about our county being, the smallest one of all of those counties, we're still at a pretty high rate per 100,000 people. And then this is looking at hospital data and who's hospitalized. Currently, obviously you can see the big spike in Colorado, and now it is going across and sort of at about 160. As far as deaths in the state of Colorado, there's still fewer in the past. And then let's talk about Lake County. So as you can see, we have continued to spike once again. So this is us, our curve goes up, we have a little less cases, but this is only, in a week's time. So we saw, more cases in that 1 week than we had seen in the previous 3 weeks. So that's something to be mindful of as we continue to be out and about interacting. This is the cumulative data that we have, and you can see we were doing really well flattening that curve. And then as we started to move about, we are now starting to increase our curve at this point in time. As you can imagine, we continue to monitor what that looks like and to see what's happening in our community as well as other communities to see if there's any opportunities. And the pieces that we continue to talk about, we know the best preventative measures currently truly are that social distancing piece, which includes wearing a face covering. And then at this point in time, there hasn't been any hospitalizations, so that we've been very fortunate with. And at this point in time, we have not had any deaths. Does anyone have any questions around the data?
Feel free to unmute yourself, or you can paste it into the chat and I'll read it out. Or if you're calling in, you can *6 to unmute yourself if you have a question.
Hi, Colleen. This is Becca.
Oh, hey.
I just wanted you to clarify one more time if we have had hospitalizations in Lake County due to COVID-19.
So Rebecca is our retail food manager person in Lake County Public Health, and we have had hospitalizations earlier in the response, so in March into April, but we have not had any hospitalizations in the last 2 months.
Thank you.
So if you have any general questions at this point in time, I don't necessarily have any more updates to share unless someone else wants to prompt me with something that I should have shared. So that would be helpful as well.
So Colleen, our first question is, are all the cases Lake County residents or are any of them visitors?
Great question. And so what we're tracking, so the case count that I gave you at 50 are all Lake County residents. So when we present our numbers, they do not, so when we, meaning Lake County Public Health Agency, puts up those numbers every time we get a positive case, that is only for Lake County residents. Lisa's been tracking some things on the side of if somebody's come through her office specifically to get tested, but that's not reflected in our positive count.
We had a question earlier today, Colleen, via email about sort of best guidance for businesses and facilities who aren't quite sure how to enforce the request and requirement of patrons to wear face coverings when they're in their facilities.
Yes, so right now we do have some additional signage in the business folder, resource folder, that if businesses are able to put it up, it basically talks about that consideration piece of, it's not just about, when we know we're wearing a face covering, we're protecting someone else, and if someone is wearing theirs, and they're protecting us, right, from spreading it to each other. And at this point in time, like, enforcement has been like the crux, right? We've had multiple conversations around it. We do know that our local law enforcement will step in if there's a criminal action, but these are mostly civic action, or civic things that are happening. And so we don't want to put businesses in a bad position. I think it's important if they're comfortable enough to say, hey, do you recognize that we're asking people to wear face masks, and if someone's like, oh, I don't have one, you have the ability to refuse, or be like, hey, can you please be mindful in the future that we're requiring face masks. And so I think that's a piece of it, because right, I think we don't want people taking it into their own hands or having a confrontation. It continues to be like, do your best in the situation with what you're comfortable with, and do your best to protect yourself, and keep that 6-foot spacing and things like that. There's always opportunity for all of us to educate in a business setting if someone's coming into your space, educate, but that's as far as we're able to take it at this point in time. Unless truly you feel that there's a threat, then there's no opportunity to, if you truly feel there's a threat, that you would have the ability to call the police. So at this point in time, if there are complaints about people not complying in public, we ask that you do not call dispatch. We ask that you email environmentalhealth@co.lake.co.us to report that. And that includes, not necessarily people in public, because it's not really feasible to track those people. It's really about if you see other things that you think can be done well, whether, that's workers and staff and all those other pieces, so that we have the ability to educate folks. And then we, as Beth just wrote, we have the ability to customize things for folks if we need, or if there's, as we continue to say, we'll take feedback if there's a better way we can be educating people around this, or, if we're missing a piece that you might have to say, hey, this might be a better way to do it. We totally appreciate that. So thank you.
All right, Colleen, our next question. Would you give an example of what it looks like in wearing a face covering in public, walking down the sidewalk versus walking into a store?
For me, especially our sidewalks, and especially with all the construction, I would say that if you're currently walking around our main street, that you have a face covering on. It's just, you cannot avoid and maintain 6 feet between the construction and the tables that are out there. So I would recommend wearing a face covering as you're walking through. To properly wear a face covering, then it needs to cover your nose and mouth. It doesn't have to be a mask. It could be a bandana, it can be like a turtleneck, or they call it a buff or a gaiter. And obviously when you have the ability to take it down, if I know some folks have some issues with keeping it on for a long time, if you feel that you're in a safe space where no one's around, obviously take that. But if you're going to be, interacting with businesses and walking around, these crowded areas, then that would be the recommendation, that you're not going to pick and choose like wear your face covering. So it is required to step into any of those businesses, as well as if you're going to interact with anyone in less than 6 feet distance.
We have a question which you sort of answered regarding Dr. Lisa's data, but are we tracking visitors who may be diagnosed while they are in Lake County?
Technically, anyone that's been diagnosed and is infectious should be isolated in their county. So anyone that has a positive in their respective county is the same thing that happens here. We, you get in contact with them, they are required to isolate, and then their contacts are required to quarantine themselves for whatever that time period is. And so we don't have the ability to, we don't have access to that data. If, for example, if someone breaks quarantine and comes up to visit us, we wouldn't have that ability to know that information.
Do we need
to
to
add one thing?
Oh,
Sorry.
please, Jane, go ahead.
I'm Jane. I'm one of the nurses of public health. I do want people to know that if we have neighboring communities that have connections with Lake County and they have someone quarantining in our county, we do work together with all of our surrounding counties on that. And so we do know when someone has been possibly exposed in our county, but not by someone living here. Just know that we do work together and we're in constant communication with all of our really all the counties in the state, to be honest. So
thank you, Jane. That was a great clarification on that as well.
Is there anything else that you'd like to share around contact tracing? I know that people frequently have questions about just what that entails and sort of the importance of being forthright about all the people that you've been with, that it's not, you're not going to get in trouble for doing anything or being with people. It's just really for the public good.
Great. Yes. So I will tell you, our contact tracing really depends on the information that people give us. We're not like private investigators. We don't dig into people's lives. We just ask questions that are required. We ask people really to give us as much information as possible when it comes to contact tracing. The more names and numbers we can gather, the more people we can reach out to. Like Beth said, there's not a, I don't know the word I'm looking for, but there's no disciplinary action we take. We're only here to educate and decrease the risk. Our only goal whatsoever is to stop the spread of the disease. We have no other ulterior motives. Yeah, so there's no other thoughts involved except for making sure everyone that you've had contact with has been notified and is safe, basically, is all that we care about.
Yes, and I think, the word trace, I think sometimes has some negative connotation with it. It's truly just an investigation. It's just truly like, let us know so that we can keep, our community safe. And I think that becomes the underlying, it's about prevention, preventing that spread, decreasing, the spread, slowing the spread, because obviously, COVID-19's here, it's been with us for a while, it'll be with us for even longer. So I think that is important. So the more information we have, the better we are at controlling that piece, so that we can continue to remain open versus going backwards, because all of a sudden we have an explosion that we've no idea because no one has shared that information, and then we have to go backwards, if you will, and start closing pieces and businesses and things to keep our community safe.
Next question is, are family gatherings and reunions inadvisable right now?
In all honesty, yes, right? In the sense of, I don't know many gatherings that we're seeing, from families that are wearing face coverings, that are remaining 6 feet apart. So if you feel that you can do that effectively, then, obviously that's your choice. We do have the ability to gather up to 50, but so many of those restrictions around that group size, especially in our businesses and our venues, is dependent on the square footage. So when I think of, my house, if I put 50 people in my house, every single person would be shoulder to shoulder, and there wouldn't be any opportunity for social distancing. And so you have to kind of weigh the risks that you are, taking, and then in turn putting other people at risk, within your family, especially when you think about multi-generational families. We still know that people 65 and older are more susceptible and have poorer outcomes with COVID-19 than younger folks. So it really becomes that personal decision. And so, yes, as much as it pains me to say, if it was my choice, then I would say, yes, it's not my choice. It's your choice to do what you need to do. And whether that's, doing it responsibly or, just doing your best. So that's all I can ask.
Is the face covering requirement in Lake County similar to that of any neighboring counties?
Yes, so currently Chaffey County does have the same requirement. Gunnison County has that requirement, and a bunch of other counties. I can't speak to Eagle and Summit. I don't know that answer offhand. I know it's strongly recommended like we have been doing, but I can't speak whether or not they've made it a requirement at this point in time. So yes, it's not unheard of. It's not like we're the only ones doing it. And, I know down in the southwest part of the state, that's a lot of the pieces where, you're rolling to town, there's a big, billboard sign that says, cover up, or, face coverings required. And so, we are following suit. And it's really just to emphasize that point that we know that this is one of the most effective strategies that we currently have. So the more that we can put in that stronger language is to encourage folks to do that. So that's where we're at.
I'll chime in a little bit about the face masks. Just some pushback that I've seen and heard is that no, the face coverings don't prevent the virus from entering or passing through the mask or the face covering, but they really are to keep those droplets basically to yourself. We all spread droplets through talking, coughing, sneezing, breathing, and so it's not about the size of the virus getting through the mask or face covering. It's literally just to keep that spread from being pushed further out.
Thanks, Jane. Like to Jane's point, it's a prevention measure, right? It's one of the tools that we currently have. It's not 100%, obviously, but it's a really strong tool that we have.
That's a great question. How do we comfort children in the workplace if we are not able to, physically interact with them?
I think it depends on your employer and what the rules and requirements are with childcare. I know that they definitely have different requirements when you can maintain social distancing. That is, the number one thing. But I also recognize that people have to make those decisions. And if you have a face covering on, that's, safer to interact with, children. So I think that's something to check with your employer and see where you guys are comfortable at, as well as parents that might be, bringing their children there. I think that's, a decision that has to be made through the individual employer, especially when you're doing childcare specifically. Becca, I don't know if you have anything to share on that, as I am not the subject matter expert on childcare, if you will, but I'm not sure what those provisions are in that particular work environment.
Sure. This is Rebecca, Environmental Health Specialist at Lake County Public Health. I think the expectation of the child care guidance right now from the state is not that someone would be 100% socially distanced from the child they're caring for. For example, if that child is still in diapers, they would probably have to change the child's diapers at some point during the child care time. So it's more important to wear face coverings and do social distancing when you can, and also keep with stable groups of people. So the same group of people every day and children.
I have a family reunion in Oklahoma in early August, and I'm reluctant. Am I justified? I will keep my editorialization about going to Oklahoma in August to myself.
You know, obviously it's a personal decision as always, but you know, if you were asking me as like a public health official, then I would say that is a high risk. We know, and I apologize, I don't have it in front of me. When we look at like the high risk categories, gathering in large group sizes is the highest risk category. So it's about risk reduction and everything we're doing in prevention. So you would have to make that decision on your own. But if it was truly looking at the risk, that's the highest risk. You're putting yourself at the highest risk.
Is there ever an event that would cause a business or restaurant to be closed down?
I think if you're alluding to the fact that if we had like an outbreak in a restaurant, then there are some parameters in place that would require closing a business down and, you know, gathering that information, doing our investigation, doing a deep clean if we really feel that there is an outbreak. There's also the possibility of if folks are not in compliance with some of the requirements that we have. So example, you know, for us specifically, right, we oversee both, well, not both, but like retail food. So if we have like a retail food establishment that's out of compliance, that is, you know, there is a very detailed process of, you know, how we interact with them, educate them, and try to bring them into compliance. But if it was something that we got to, you know, like the third, and I forget, and Becca, you can jump in, but it's a very organized, like, first is, you know, this, second is this, third is that, and trying to bring folks into compliance, which would be our number one. Our number one is already about educating, bringing folks into compliance, but that might be a reason as well that that a business might have to close, if you will, and not permanently. Like that's the whole point. Like nothing, hopefully, is permanently. It's just like, hey, how do we, you know, modify these pieces and make sure that we're doing things safely.
Thanks, Colleen. This is Rebecca from Public Health again. We would work with the nurses on contact tracing in that establishment, and we would come up with the best protocols, but each business should be prepared for the possibility of closure to perform the contact tracing and mitigation that Colleen just referred to. Temporary closure.
Yes, thank you, Becca.
And if someone were to report to public health that a business or restaurant was observed to be non-compliant, what would happen with that complaint?
Becca, would you like to take that one as well?
Sure. So all complaints are tracked by Lake County Public Health and followed up on. So it depends on the complaint itself, the severity of therein, and also what we discover once we reach out to the person in question or the business in question. And just to add, it doesn't always stop at a phone call. I do meet with people in person too, as the result of a complaint.
Thank you to you guys. I also wanted to remind if anyone's calling in that you can *6 to unmute if you have a question but aren't able to put it in the chat. Any other questions, comments, thoughts, concerns that we would want to address tonight?
Hopes, dreams, aspirations.
Beth, I know you had mentioned earlier today possibly addressing the efforts Lake County might be making as far as signage for face coverings.
Yeah, I just, there was a question regarding notification to visitors to Lake County who may be coming in unaware of the requirement for face coverings. and some of the ideas we had around ensuring that folks were well aware of that prior to stepping across the threshold of a business. And we had been investigating things like, vinyl signage at the county lines. Were there digital display signs available where we could put some of the messaging that just alerted people well in advance what to expect when they came into the county? So we don't have any solutions quite dialed yet, but those are the things that we're investigating and, hopefully can pursue here in the coming days so that we've got, the ability to let people know ahead of time just what the expectations are and continue to have that positive messaging so that the business owners don't feel like they're the ones having to relay that in ways that they're just a little unsure about right now. Well, thanks all. If, last call for questions. And if everyone's good, thanks again for taking some time out of your evening to join us. And, thanks for continuing to be engaged and involved and educated, and have a good evening.
Yes, thank you all so much.